half-hearted efforts or businesses started without the right intention, those don't work. You need to make sure, first of all, that you have the right mindset for becoming an entrepreneur. There is really no room to basically say, oh, now life is getting bad, I'm depressed, I think I should stop or something. There's really no chance, right? You're probably not an entrepreneur out there. Across the world, what happens is, when a drug is invented, if it is selling for 100 rupees initially, the cost of making the drug may be only 1 rupee. You can get good quality everywhere. It is not a problem. If you pay price, you will get it. But the thing is, the trick is to get it at an affordable cost, at a cost at which, at the best possible cost. That's what we specialize in.
নমস্কার। দেখুন, আমরা বিভিন্ন ওষুধের দোকানে যাই এবং আমরা ওষুধের দোকানে গিয়ে বিভিন্ন রকমের ওষুধ কিনি, কিন্তু আপনি কখনো ভাবতে পেরেছেন যে একটা ওষুধের দোকান সেটা দিয়ে একটা রিটেল চেইন করে ভারতবর্ষের বুকে প্রায় 5,000 কোটি টাকা রেভিনিউর একটি কোম্পানি তৈরি হয়েছে। সেটি গোটা ভারতের প্রায় 10টি রাজ্যে ছড়িয়ে পড়েছে এবং সেটি আরও একটি প্রমাণ করছে যে কিভাবে খুব বেসিক একটা কাজকে বড় স্কেলে করলে কত বড় একটা জীবনে সাকসেসফুল হওয়া যায় কিংবা এন্টারপ্রেনিয়রশিপ করা যায়। আজকে আমাদের এই পডকাস্টে যিনি অতিথি, তিনি আমাদের ভারতীয় তথা বাঙালিদের কাছে একটি উদাহরণ হতে পারেন। তিনি ইয়ং জেনারেশন যারা এন্টারপ্রেনিয়র হতে চাইছে তাদের কাছেও একজন উদাহরণ হতে পারেন, কারণ তিনি খুব সহজ কাজকে বিরাট বড় স্কেলে করছেন। তিনি আর কেউ নন, তিনি মিস্টার মধুকর গাঙ্গাডি রেড্ডি। তিনি মেডপ্লাসের ফাউন্ডার অ্যান্ড সিইও। চলুন না, তার সাথে আমরা কীরকম আড্ডা দিলাম সেটা আপনাদের সাথে একটু শেয়ার করা যাক। Sir, first of all, thank you very much for giving us the time. So, I want to ask you a question that I always have in my mind, that how is and was your journey in Medplus? Journey kaisa raha aapka?
So, Arijit, first of all, thank you for bringing me on the show. So, the journey actually started in 2005 actually. The Medplus journey, right? But I've always been an entrepreneur much before. I actually finished my medicine in 1991, and since then I've always been in business. I was in business in India for 7 years before I left for US, and I used to be part of a small business in US. Started my own company out there. Then I went to a business school. I went to Wharton Business School, did my MBA. There, during my MBA time, I came across an article which said that 30% of all fake drugs in the world were made in India. And this was not a random article, this was by WHO. So that got me thinking about a business plan where you could basically create a really good business by guaranteeing genuine medicines. Given that there was so much fake medicine, I said, you could start by just saying, I'll guarantee you genuine medicines, and that could be the business. And I wrote that business plan in my 4th semester at school.
Okay.
So that was part of my coursework. And after that, 2005 June, I graduated from Wharton Business School, came out with an MBA, spent 3 months in US trying to raise the money. $500,000 I raised from friends and family and everyone else. Then came back to India in September 2005. And we opened our first store in Hyderabad in 2006. We actually started with 47 stores on day one.
Sure.
So that's how we started. The idea was always going to be that, you set up a warehouse and you buy all the medicines, make sure that they are genuine and all. And then you would need to have as many stores as possible around that to take care of the cost of the warehouse. And that's how we started with we wanted to do 50, we started with 47.
Okay. Sir, actually from 2006 to 2024, you have a long journey. You already launched your IPO. Sir, I want to ask you that right now the present scenario of Medplus and your future plan.
So at present, Medplus is present in 10 states. We have roughly around 4,400 stores. We are the largest independent pharmacy in the country right now. The goal is for us to actually grow across the country over a period of time. The goal is to become, even much bigger. India has got overall 9 lakh pharmacies. So 4,400, while it is large, it is nowhere close to being the largest, nowhere close to having a significant share. So we want to grow it. That's one. Second, our goal is to make sure that everyone in the country has access to inexpensive, low cost, great quality medicines. We expect that we can actually do this by one thing, by taking advantage of one thing.
Definitely.
90% of medicines sold in the country are all medicines which have been invented long back, on which there is no patent which is existing. So which means anyone can make it. They are otherwise called generic medicines. So 90% of medicines being sold in the country are generic.
Okay.
Right? Now, if a manufacturer makes it and he has to market it, he has to go to a doctor to get him to write the prescription, he has to have a marketing force to sell it, then he has to have distributors and all, then all those costs add up and it makes the drug more expensive.
Okay.
With someone like us, because we have our own stores, we already have the customers walking into a store and we can get them made at the same facility as which the large manufacturers making it. Given that we are cutting out the distribution and marketing costs and all, we know that we can give the same quality at a much, much, much lesser cost. So our goal is to make this available to everyone in the country. That's the goal, I would say.
Yeah, definitely. That's why you are launching your own medicine brands, actually.
Yes. So, Arijit, if you look at it, across the world, wherever you go, right, whether you go to US or UK or any other place like that, once a medicine, its patent is expired. Meaning, when an inventor makes a medicine or when drug discoverer makes a medicine, invents a medicine, he is given a right to sell only, he is given an exclusive right to sell it for 17 years. That's the patent time. After that, anyone can make it. Right? Okay. So across the world, whenever this patent expires, companies usually make it and sell it in only one name. Now, there are large chains like Walgreens and all. What they do is they will either sell, they will make the company, they will make the brand and sell it in their own name, and they will reduce all the other costs and sell it. Only in India, because we did not have a chain like Medplus or some very, very large chain in the past, we were basically going through manufacturers, distributors, retailers and all, and we were just adding on that cost. Right? So for us now that we have the size, we feel that we can now get the medicines directly and supply directly to the customers, thereby reducing a significant portion of the cost. Definitely. That's the goal.
Sir, I want to ask you a very important question here, that in India, generally our respected doctors are prescribed the name of some medicines, not the compositions.
Yes.
So you are making the same composition or same molecule with lower cost.
Yes.
So I want a message to all of the customers, or our viewers, that please clarify, or please give a clarification that the molecule is actually important, not the brand name. So for our audience, please describe it.
Yeah. See, the way it works is, let us say I'll take a very, very common situation, right? You have fever. If you have fever, Dolo works or Crocin works or whatever works, right? Yeah. These are all brand names. The actual drug is paracetamol. So you can take paracetamol in any brand and it will do the same job. Absolutely same job. So you don't have to, ask for Crocin or Dolo or this or that. You can take paracetamol, any brand, that is fine. Exactly. And that is true for any medicine, whether it is for a BP medicine, whether it's for diabetes medicine or whatever. Doctors learn about what medicine they need to prescribe by the pharmacological name. They don't learn by the brand name, right? So hypertension ke liye, if you know that this drug is basically going to treat you, you basically learn that. How much mg, what are the molecule, what are the compound. But after they come out of school, because there are so many people making this, and some of them may not be of good quality, they will usually suggest and say, sir, you please take this from this brand because I know the quality of this manufacturing is good. Hence they write the brand name, right? But if you are convinced that the quality of manufacturing of a substitute is equally good, then you can just take it and you can save money. That's the thing. So let us say you have telmisartan, 40 mg. Now it is made by hundreds of people out there. Hundreds and thousands of people actually out there. Now it could be given in several different brand names. as a customer or as a patient, when you basically take a prescription from a doctor, you definitely try to take what the doctor has told. But if there is an alternative which is available at a much lesser rate, then there is no problem at all. As long as telmisartan 40 mg is what doctor wrote and you're also taking telmisartan 40 mg, there is absolutely no problem at all. You just have to make sure you're buying it from a good quality manufacturer. That's all.
There are so many companies who are already expertise on this field, in pharmaceutical fields. They are making some medicines for last 20-30 years. How, as a customer, I will be sure that the quality of the drugs Medplus is providing us is a good quality, or the same quality which is already available in the market?
Sure, good question. Yeah, you're absolutely right. Price is not the only thing, right? We have a 50 to 80% discount, but your question is, how do we know that the quality is same as all the large companies? My answer is only very simple, and I've answered it in a little bit in the past. Any of the top 20 companies, if you take, each of them is making several hundred drugs. Some of them are making 200, 300, 500,000 drugs and all. There are several lakh drugs being made out there. Now, all of these guys can't make all the drugs in their own factory. It is not possible. So they definitely outsource some of these drugs to other contract manufacturing companies. The result is that fantastic contract manufacturing organizations have come up. The ecosystem of outsourcing has developed very well. So what we do is very simple. We go to the best, the top guys in this whole contract manufacturing, and get our drugs made out there in the same facility.
Okay.
In fact, if you look at it, if you can look at the drugs out there, they'll be manufactured by and marketed by. Manufactured by is where we get our drugs made. Now, if you go to any of our shops, our people will show you where it is getting manufactured. In the same facilities where we are getting our drugs manufactured, all the top 20 guys are also getting it made. So quality-wise, you actually need not have any doubt at all.
Definitely. And sir, about the lesser cost or discount, how as a customer we shall be sure that Medplus is giving really or providing us a really discounted price?
Yeah. Obviously, there are people who will hike up the price and give a discount and all.
Definitely.
So we're all used to it out there and all. So for us, the way it works is this. So we look at the main person. How do we set the MRP?
Yeah.
Right? We set the MRP by looking at the main person who has invented the drug, whoever has invented the drug, or whoever is the market leader. We take one or two out there, whoever is selling the most. We look at that, we match their quality, we match the same facility in which they are making it most of the times and all, and we put our price at the same level as that guy.
Okay.
Right? And from there, we give a 50 to 80% discount also. In some cases, even higher than 80%, right? 50 to 80. And that's how you will see that the price is less. Now, given that, as I said, each drug is being made by thousands of people. So some guy could have a slightly lesser MRP than us, some guy slightly more than us, and all. That is all over the place. So it's very difficult to figure out which is the right MRP. We do it by the market leader. Now, how can you as a customer make out whether you are getting a genuine discount or not?
Yes.
Very simple, right? You look at the net price which is being sold to you. And see what are the net price being sold by other guys. You will see a big difference. So one way to look at it is, look at the medicine which you are buying. There will be two names out there. The name on top is the molecule name. Right? That is the molecule name. So telmisartan 40 will be on top and telmis will be on bottom. Or pantoprazole will be on top and Pand will be on the bottom side. So you have to look at the molecule on top. Now, take this molecule and we will show a QR code here. You can actually go to this website using the QR code. Put in the molecule name.
Okay.
You will see the net price which is available, and you will see the prices of all the other brands also out there. The average price of the brands. And you already know what price at which you are buying. You're already buying some medicine, so you know. Compare it, make your own decision. Right? You don't have to buy only this, see the prices. So very easy to make out. We have list of all the 500 to 700 odd drugs which are out there. All you need to do is identify the molecule name on your tablet, go to this site and put it in and see the net price.
Sir, already I watched a video that you told there that you are also, concentrate on to order this medicine, to produce this medicine from a good vendor.
Yeah.
So, tell something about the production.
See, the way it works is this. In India, I'll just give you a little bit of the background, right? We have roughly around 800 odd products only, which we sell. In any medical shop, only around 800 odd molecules are there. And these account for 80 to 90% of our sales. But the same product is made and sold under hundreds of thousands of brands, lakhs of brands, right? So what does it mean now? That basically means that if your doctor writes a prescription, you could find the same thing in the store, or because there are so many different brands, you may or may not find the same product out there, and you may have to go and take an alternative. Now, before you take an alternative, what do you need to make sure? You need to make sure that the alternative is also made by a good factory.
Definitely.
Right? Now, so that's one part. You have to go to a good factory. That is very important. The second part of the overall thing is, now, how do you know it's a good factory or bad factory? There's one or two very simple ways in which you can find out. If you look at any of the top 20 companies in the country, or top 30, top 40, each one of them makes roughly around 1,000 odd products. Some of them make 500 to 1,000, right? Now, are they making all 500 in their own factory? No, not possible, right? You cannot have a factory in which so many different compositions are getting made. So some of them, they are outsourcing. Now, what has happened is, given that all the top companies and even the smaller companies are all making so many different products, some of them have to be outsourced. So this whole contract manufacturing, which is because of the outsourcing, that ecosystem has come up very nicely. So there are some manufacturers who make it for everyone, who make it for, let's say, Dr. Reddy's, who make it for Cipla, Torrent, Lupin, bunch of other guys, right? So they are all making it for all these big companies. Some of them are very, very good, very, extremely good quality manufacturers. We make sure that we go to only those manufacturers who are making it for the top 10 companies. That's all. So we never get anything made by a company which is not already making it for one of the top 10 or top 20 companies. So that way we ensure that we are going to the right manufacturer.
Definitely, sir. Sir, I want to ask a question from you that as a CEO and as a founder, what do you think that why Medplus is so special? Means what are the 2-3 important factors about the Medplus?
See, one of the main things about Medplus, right? And, I'm pretty sure people in Calcutta will know it, as do people.
I'm also a regular customer of Medplus.
Thank you for the business. Yeah. As do people in Hyderabad, Bangalore, and Chennai, right? So, one of the main things which we have always focused on is, while we are giving genuine quality and we are giving the best quality out there, we have always focused on making us the best priced store in the country. We started with a 10% discount. We moved to 15, we moved to 20, right? Now, with our own brand, we are giving between 50 to 80% discount. See, you can get good quality everywhere. It is not a problem. If you pay price, you will get it, right? If you pay the right price, maybe you will get it. But the thing is, the trick is to get it at affordable cost, at a cost at which, at the best possible cost. That's what we specialize in. Great quality, but at a price at which no one else can match us.
Definitely.
That's been the thing. That's been one of the main things for us, customer centricity, as you would say. Always focus on quality, but give it at a price which no one else can match. That's been the Medplus motto.
Sir, now it's also a fanboy moment for me also, because as a young entrepreneur, I'm a big fan of you, and definitely so. I want to ask you some personal questions right now.
Sure.
Sir, what is your daily routine? Because we all want to know that a person who is managing a company around 5,000 year revenue, what is his actually daily routine? How you managed your time?
Sure, I'm happy to talk about that. See, when you are doing something like this, right? When you are managing, let's say, a 4,400 store company with 22,000 employees and all, unfortunately, if you're really focused on the job, you have very little time for anything else. So that has been one big thing for me, that I've not been able to pursue too many things. I only do 2 things, right? Outside of work, I end up, either going to the gym
Okay.
And I spend at least an hour in the gym on most, let's say, obviously you can't do it every single day, but 5 out of 7 days I end up going to the gym. And outside of that, I read pretty extensively. Kindle is my constant companion, so I end up reading quite a lot. And off late, I've been traveling a little bit.
Okay.
So these are the only other things. Otherwise, I am in the office at around 8:30, anywhere between 8:30 to 9, and leave office at around 8 o'clock. So honestly, that doesn't leave too much time for anything else.
So you started. You already told us that you was in USA and you was always be an entrepreneur.
Sure.
So sir, do you think that your school or college life, there is a connection between your entrepreneurial journey and your schooling or your college life? There is any connection?
I'm not sure how to. So the way I see it, right? I went to a medical college.
Yeah.
And finished my MBBS. So that is not really a background which lends itself to become an entrepreneur. Entrepreneurship was something I always wanted to do a little bit more than what I always wanted to be a businessman. Let me put it that way, right? So even while during my days at college too, I wanted to be doing that. So immediately after I finished, I got into a small business and started. Towards nearly 10 years after that, 10 years after I came out of college, after doing several things, I went back to a business college again. So I went to University of Pennsylvania's business school, which is Wharton Business School. And obviously by this time I was, completely off the mind that I would only be in business and nothing else. And so I went to school, and even while at school, it's a very large class. Honestly, some of these business schools in US have got anywhere from 750 to 800 people in 1 year. So I would say maybe I was among the 5% of people who went out and started a business, because most of them will end up going using a business education to go get a job. So a lot of them do very well, go to consulting, go to investment banking and all. For me, though, it was always going to be business. So I wrote several different business plans. The last business plan which I wrote in my final year became Medplus.
Okay. Sir, as you always wanted to be an entrepreneur, sir, I want to ask you personally, because you already told us that the future plan of Medplus. But if I ask you that your dream as an entrepreneur, what is your actual dream as an entrepreneur?
I started Medplus, and I also started several other small ventures here and there and all. But it has always been towards, so I think each one has got a separate one kind of mindset, right? There are people who will do business in the luxury side. They will create fantastic buildings or hotels or let's say brands which sell, which create very, very exclusive products and sell at a very, very high price. That's one kind of thing. And there are some people who are always into manufacturing or something like that. I've always been I always had the trading kind of mindset. And it has always been of the value pricing kind of thing. So a lot of the businesses which I have started actually have been around this. Medplus, of course, has been successful. But I've always, tried to figure out a business by which you could drive down prices by, attaining big scale. So that's been my mindset. So Medplus is, of course, exactly that.
वो वक्त जो हर एक एंटरप्रेन्योर का सपना होता है कि द IPO ऑफ Medplus व्हेन लॉन्च्ड, सो वो वक्त कैसा था, कैसा फीलिंग हो रहा था अंदर से?
Obviously वो तो it was a very, very happy moment for me and rest of the company and all the other people who have been with the company for several years now, right? It happened in 2021. When I started the business in 2006, I thought we'd do it in 3 or 4 years. So it happened only around 10 years late, but at least in my mind. But after that, but all said and done, that I was being a little naive when I thought that we could actually get that scale and do IPO in 4 or 5 years. It ended up being that, which is okay. But all I can say is, as you said, it is, most of the entrepreneurs dream of, getting a successful IPO and all. It is a fantastic moment, which, will forever be in the collective memory of all the Medplus people and all.
अभी ना इंडिया में एक स्टार्टअप कल्चर चल रहा है एंड सो मेनी यंग और टीनेजर्स आर want to be an entrepreneur, successful entrepreneur in the future. Sir, as a successful entrepreneur of India, I want to ask you that some suggestions to them then how they can be successful in future in this journey.
So, a couple of things, right? One is this. You need to make sure, first of all, that you have the right mindset for becoming an entrepreneur. And I would say, to test it, it is very easy. Don't get into business because you feel that you don't want to work for someone. That is not the right way, right? You should get into a business only if you feel that you can do something which is faster, better, or cheaper, right? You should have some USP. The starting point of the business, that is important. That should not be, boss, I've been working for someone or the other all my life. Now I think it is time I started my own business. Business should not start like that, right? It should start from an opportunity which you see, or an inefficiency which you see in the market. You see that and say, why are they doing like that, right? I could perhaps do it, much better, and I could possibly deliver the same product at half the cost, right?
Okay.
Or I could deliver a higher quality product, or I could move these things faster, right? It has to be cheaper, better, or faster. That's all. If it is not, then don't get into it. If you find that opportunity, then you dig in, do the research, see if the market opportunity is large. Because from the surface, everything, sometimes you may see opportunities which are not really right. So do the research and find out if there is really an opportunity, and if you can fund it through your own means or through friends and family. If you see an opportunity out there, then definitely you should get in. Once you get in, right? Maybe in the initial stages while doing research, you can do a little bit of part-time this and that. You're working somewhere else, so you're doing some research, you're building some proof of concept, that is okay. But after that, you have to be sure that you want to do that business full-time. And that should consume you 24/7. You should work from morning to evening. If you're not that passionate, if you want work-life balance, if you also want to do this and that and all, then better you don't do it, right? So, the point I'm trying to make is this. It should get originated from the point where you think, no one else is doing this, I can do it, there's a USP here.
Yeah.
And then you should do it, you should do it full time with as much energy as possible so that you can really, become successful. Half-hearted efforts or businesses started without the right intention. Businesses because you started because you have a lot of money from your father and say, okay, everyone expects me to be a businessman, so let me go and do something out there. Those don't work.
Definitely. So sir, I want to ask that there is so many words जो मेरा चाइल्डहुड में इतना नहीं था. प्रेशर, डिप्रेशन, फ्रस्ट्रेशन, स्ट्रेस, लाइक दैट. सो एंटरप्रेन्योर का ना ये बहुत होता है. तो how you personally handle the pressure or the stress of work?
Honestly, as an entrepreneur, you don't really have the luxury to think like that, right? So if something is going wrong and you are the person who is responsible for the business, you have to find a solution. You can't just back down and say, I will think about it. So a lot of times you will find that when you're pushed to a corner, you will find a solution.
Definitely.
Right? Otherwise, the same solution will come to you which you have been discarding or you have not been thinking about it, but when push comes to shove and when you have to do it, you will find a solution. So there is really no room to basically say, oh, now life is getting bad, I'm depressed, I think I should stop or something. There's really no chance, right? You're probably not an entrepreneur out there. So as an entrepreneur, you're solving problems day in and day out continuously. And when the problem comes in, you are putting all your effort to solve it. Once you solve it, then you automatically feel relief and happiness about that. So that keeps you going. Then till you get to the next problem. So it is one series of things, and some people thrive on it. Right? Only those people become proper entrepreneurs.
Definitely. Sir, what do you think about the future of Indian pharmaceutical industries?
Given the fact that we are looking to disrupt the industry in a major way, I think it's the right time to talk about it. Let me just, give you a little bit of the background. As I said, there are only two types of medicines out there. One is patented, which means someone has discovered the medicine, and he gets the right to sell that medicine, and no one else can copy it for a period of time, 17 years typically. Years. From the time he has filed the patent to the time it expires. He has that time in which he can sell it at whatever cost he wants. No one can copy it. So he has no competition. He can make as much money as he wants. That is to encourage the person to invent. Otherwise, he will not have any inventions at all. Because the process of invention is a very, very tough one, right? If you want to invent one successful one, you might have failed in 10 or 20. So the cost of all the failures also has to come here. Hence, you get that time to do it. So that is the patented drug. Once it comes off the patent, then anyone can make it. They can just say, okay, now I've created this, because the name of the drug and what it does is all there. So some reverse engineering is possible. People will make it and say and demonstrate that it can do the same thing which the patented drug is doing. And they sell it. That is called the generic. So anyone who's making the drug other than the original discoverer is all called generic. Okay. Generic manufacturing, right? Hundreds of people make the generics. Some people focus on this patented, some people focus on making a immediate copy and selling it out there. There are only two types now. Across the world, what happens is, when a drug is invented, if it is selling for 100 rupees initially, the cost of making the drug may be only 1 rupee. But it sells for 100 rupees. And that is to cover his cost of other failures and all the other things and everything else. Marketing cost, this, that and all. May sell. Once the patent comes off, the original guy now sells it for 40 or 50 or 30 rupees. Right? He drops the price. The generic guy also makes it and sells it for slightly lesser than the original discoverer. The original guy is always original. He is always going to be there. Anyone else who copies it after the patent is called a generic guy. And there are several guys. And this guy is selling at 40, this guy is selling at 30, and everyone is running the business out there. Now, across the world, what happens is, once the drug comes off patent, when you go to a medical store, the medical store guy is giving you only one generic. He is saying, okay, sir, original drug आपके लिए ये है और इसका generic version है इतना है. You can take whichever one you want. Some customers take the original one, some customers take the generic one. Only in India. And that is because the pharma chains, the medical store chains, have 8,000 stores, 10,000 stores and all. They're very, very large, multi-billion dollar, $80, $100 billion kinds of revenue. They are able to get all this made because they are large chains. They are able to get it made, and so they get it made and put it out there. In India, we didn't have those chains, right? Why we didn't have the chains? So what does that mean? Today, as I said, only around 800 drugs account for all the sales. Now, to make these 800 drugs, what does it mean? When you go to a manufacturer, he will tell you each drug you have to make for 5 lakh units or 10 lakh units or whatever, right? So what does that mean? If you don't have that many stores, you can't sell all the 5 lakh units, right? So if you can't sell that, then you can't make it on your own. So, but with someone like Medplus, with our size, we have 4,000 stores. Even if you make 10 lakh units, we can sell 200 per store and we can get it. We can sell it. So someone like us is now able to do what people in US have been doing for several decades. So we're doing the same thing now. So if you go to Walgreens in US or CVS or any other people, if you say you want a drug, they will tell you, this is there, this patent is over, I'll give you only Walgreens generic. There's only one drug. It is not, let's say, Cipla drug or Torrent or Lupin or this guy's or that guy's generic. It's only one generic. So what does that do? That reduces the cost and that reduces everything. Because they don't have to carry so many drugs, there's no marketing cost and all. So it reduces the cost and you give it. Now the same thing is also coming to India with someone like us. Right? Today, 80-90% of what we sell in our shops is all off patent. There is no restriction, anyone can make it. We are now able to make all of these because we have the scale. We don't have any marketing cost, because we don't have to go to a doctor to write a prescription, because you as a patient come to us, we tell you, sir, I have got the thing which your doctor has told, or I have the Medplus plan. If you want, this is 50% less, so you will take, some of you will take it, right? So since I don't have that marketing cost, I'm selling through my own store. Distributor also, I'm my own distributor. I'm able to give it to you at a very, very less price.
Sure.
So we are able to now reduce the bills. Now lakhs of people have bought the medicines from us and saved crores of rupees in bills. You know, the average bill for a diabetic or a chronic customer is roughly around 2,000 rupees in India. Now, instead of buying at 20% discount, which we used to give earlier, right? 1,600. He is now buying the same at a 60% discount average. He's buying it at 800. So he's saving 800 per month, 10,000 per year. And you can see it is the same products made in the same factory, same top factory. There's absolutely no difference, right? Saving 10,000. So what does it mean? A lot of people are going to shift and they're all going to buy, right? Who wants to pay more when you can pay much less? Now we are the first ones to start it, but I'm sure other guys will also copy it. Sooner or later, you know, all the other chains will also copy it. So what this will do is, like the bigger chains, when they copy it, the country will slowly start shifting to a generic model only.
Yeah.
So the answer to your question about what is the future, if a drug is without patent, people will only buy a generic going forward.
And they will lower cost.
And they will, of course, lower the cost significantly. That's one. There are two things happening here in the country. One, the Prime Minister also is telling everyone to buy generic, and that's how they set up the Jan Aushadhi stores and all, where stuff is available on a huge discount. So government is also pushing all the doctors to write only the generic name.
Okay.
It is a recommendation by the government that doctors should write only the molecule name. They should not write the brand name, right? How do you know which one is molecule name and this one? So it's very easy. I'll just show you one.
Yeah.
So let us say if you take this drug, it is Pan-D. This is the brand name, right? But the actual drug is pantoprazole, gastro-resistant, and domperidone. So Pan-D is pantoprazole, domperidone. So it is all, the actual name of the drug is always written on top of the brand name. So there are two names on any strip, so you can see it out there. So if you want to understand what is the molecule name, you can just put it out there, right? Okay. You will see the name which is on top is the molecule name. And that is true for everyone, every single one of those. So you can take that, maybe go to Medplus site out there, or, you know, we can show you a QR code. You can basically go out there and click and go out there and put the name in. You will see what is the net cost to you when you buy this versus you know what you're paying, right? You can easily understand. So you will understand the savings. But anyway, the point I'm trying to make is this, that there is a shift from brands to generic. Because of two things, because it is possible, someone like is already doing it. Second, because the government is also encouraging people to buy. And third, and finally, there is zero need. I mean, if you want to donate some extra money, you can go and donate it to someone out there. But you are basically donating it by basically going and buying a, you know, brand out there and refusing to buy a version which is already available at a much lesser cost. You're just wasting your money.
Definitely.
So the world will go, or at least India will go towards the generic version, where you will go, you will pick up the name of the, you'll have the name of the molecule, you'll pick up the thing which costs you the least out there. And what that means is the big drug companies will most likely end up bringing in a lot of newly discovered drugs, which are not available in the country. Maybe some of those drugs will also start coming to India, because right now, no one needs to do it. No one needs to bring in the new drugs and all, because they're already making enough money on the generic drugs out there. So now they can start bringing in all those new drugs which are otherwise not being marketed in India. So we'll probably have access to a lot more variety of drugs as we go forward, the newer ones.
And sir, my last question. As a Bengali, I want to ask you your feelings and connections with Kolkata, because lots of Medplus stores are there, and I personally a regular customer of Medplus. What do you feel about my city, Kolkata.
So, I went to a school in Dehradun.
Okay.
From my for my high school and all, and we had classmates from across the country out there. So that was a military school, and we had classmates, and some of my best friends out there were people who had come from Bengal. So I have known Bengalis all through my life, starting from that time. And one of the first cities we entered after we got out from South was Calcutta. Calcutta has been really good to us. We have, had excellent, I would say, response from the Calcuttans, who are obviously extremely knowledgeable, understand, value customer service, value the price and everything else, and value what we have to offer. So we've gotten a great response. So for us, Calcutta is one of my favorite cities, for me and for Medplus, I would say.
Thank you, sir. Thank you once again for giving us the time, and definitely we wish that definitely Medplus will grow more, and definitely will continuously get the inspiration from you, sir. Thank you, sir.
Thank you for taking the time, Arijit. Very happy to be on your show.
Thank you, sir.
Thank you.